Mr. President, I call up my amendment, which is at the desk.
Clerk will report the amendment.
The senator from Iowa, Mr. Harkin, for himself and others, proposes amendment numbered 730.
Ask that further reading of the amendment be dispensed with.
Without objection.
Mr. President, today I'm offering this bipartisan amendment with my colleague Senator Alexander and several other members of the Health, Education, Labor, and Pensions Committee to reauthorize and improve programs administered by both the Departments of Education and Health and Human Services related to awareness, prevention, and early identification of mental health conditions and the promotion of linkages to appropriate services for children and youth. The tragic shooting in Newtown, Connecticut in December brought the issue of mental health care to the forefront of the public dialogue. Many people across the nation, including the President, have said that we need to take a long, hard look at access to mental health services across the country. And I was pleased to have the opportunity to start that dialogue with my colleagues on the HELP Committee in January when we held a hearing to examine the state of our nation's mental health care system. A starting point of any conversation about mental health is recognizing that one of the most insidious and mistaken stereotypes about people with mental illness is that they are inherently violent. It is deeply regrettable that some of the discussion in the wake of the Newtown tragedy has sadly enforced this stereotype. As my colleagues in the Senate know, and as the President has emphasized, people with mental illness are much more likely to be victims of violent crimes than they are to be perpetrators of acts of violence. However, for far too long, mental health care has not been at the forefront of our public dialogue, despite the fact that mental illness affects 1 in 4 Americans every year, and serious mental illness affects 1 in 17. Unfortunately, there is still a stigma associated with mental illness, and that stigma results in too many people suffering in silence without access to the care that could significantly improve their lives. Unlike many other chronic diseases, mental health problems often begin at a young age. Half of all mental illnesses manifest themselves by age 14, another quarter appearing by age 24. However, less than half of the children with an identified mental health illness receive treatment. And the average lag time from the first onset of symptoms to receiving treatment is almost a decade. That's right, 10 years. This lack of treatment has huge consequences. Some 30,000 Americans die by suicide each year, and it's a shocking fact that people with serious mental illness die 25 years earlier than Americans overall. The shame in this is that with access to the right treatments and supports, most people with mental illnesses can recover and lead productive and healthy lives. But we need to make the critical investments that will enable this to happen, and this amendment is about making those investments. In the past several years, we have made 2 important steps forward in mental health care. First, in 2008, the Congress passed the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act. This long overdue law put an end to the absurd practice of treating mental and physical illnesses as 2 different things under health insurance. We followed this up under the Affordable Care Act by requiring coverage for mental health and substance use disorders as an essential benefit in the health insurance plans that will come on the exchanges this fall. Now, building on these reforms, we started working in the HELP Committee a few months ago to put together a targeted package to address some of the most pressing mental health care challenges in schools and communities. As I said last week, our committee unanimously passed and reported out the Mental Health Awareness and Improvement Act, which is the amendment that I just called up. The first title of this amendment provides a number of strategies to make sure we are addressing the current concerns of students with mental health needs, starting with prevention and early detection. I worked with Senators Bennett, Alexander, and Murphy on language in our amendment that encourages schools to develop and implement school-wide prevention and early intervention programs such as positive behavior interventions and supports. Such school-wide programs reach every single student in a school, every grade, every classroom. We also need to help schools link to mental health services. An NIH study found that most mental health services for school-age children were provided in schools. But schools don't always have the expertise to deal with those services. And so we worked with Senator Franken to direct the Department of Education to allow for grants that would link local schools to community-based mental health services. That's also encompassed in this amendment. Finally, this title allows for the use of Elementary and Secondary Education Act Title I funds, Title I money, to create or update school crisis management plans. These plans are key to ensuring the safety of all students and school personnel. Now, that's Title I. Mr. President, the second title of this amendment focuses on programs at the Department of Health and Human Services. I worked with my colleagues, Senator Reed and Senator Murkowski, to reauthorize the Garrett Lee Smith Memorial Act, which focuses on suicide prevention on college campuses and through grants to the states. The bill authorizes also, in Title II, the Mental Health Awareness Training Grants, a common-sense idea introduced by Senators Begich, Blumenthal, and Ayotte to train school and emergency personnel, as well as other individuals, to recognize the signs and symptoms of mental illness, to become familiar with mental health resources in the community, and to safely de-escalate crisis situations. I worked with Senator Murray to reauthorize and strengthen the National Child Traumatic Stress Initiative, also encompassed in this amendment. This supports a national network of child trauma centers in order to coordinate the collection, analysis, and reporting of data concerning evidence-based treatments, evidence-based interventions, and practices for children and their families who have experienced trauma. I also worked with Senator Sanders to authorize and improve the National Violent Death Reporting System at the Center for Disease Control and Prevention, which provides valuable information about violent deaths so we can look for ways to prevent them. Again, all of this is encompassed in the amendment that I just called up. Finally, the amendment calls for additional information to be gathered on mental health services for children, integrating mental health and substance use disorder treatments with primary care, and the implementation of recommendations made after the Virginia Tech tragedy in 2007. So I want to thank colleagues on both sides of the aisle for contributing many of the important concepts in the bill, which is this amendment, and I urge support of this amendment. And before I yield the floor, Mr. President, let me also join with a number of my colleagues I know who have been on the floor today and before in expressing my appreciation both to Senators Manchin and to Senators Toomey for the great leadership that they provided in bringing this bill forward and for the background checks that we'll be voting on later on this afternoon. I think it's another example around here, which maybe people learn it too late, I don't know, but that you don't know what kind of agreements you reach until you sit down and talk to people. You may think that you're miles apart on an issue, and maybe you are when you start. But by talking and working things out, you can reach good agreements. And I think this is an example of one. The one element that I would add to that is the amendment I just called up, which puts an important part in this bill dealing with mental health services, both in schools to children and out of schools. And I think it's just, again, a very important part of, again, what we ought to be doing to reduce violence and to respond to the mental health care needs of our young people. So again, I want to thank Senator Manchin and Senator Toomey for their tremendous leadership on this important issue. I yield the floor.